Question 91. How are critical thinking skills and critical thinking attitudes similar? Both are A. Influences on the nurse problem solving and decision making. B. Like feelings rather than cognitive activities. C. Cognitive activities rather than feelings. D. Applicable in all aspects of a person's life. Answer A. Explanation. Cognitive skills are used in complex thinking processes such as problem solving and decision making. Critical thinking attitudes determine how a person uses her cognitive skills. Critical thinking attitudes are traits of the mind such as independent thinking, intellectual curiosity, intellectual humility, and fair mindedness, to name a few. Critical thinking skills refer to the cognitive activities used in complex thinking processes. A few examples of these skills involve recognizing the need for more information, recognizing gaps in one's own knowledge, and separating relevant from irrelevant data. Critical thinking, which consists of intellectual skills and attitudes, can be used in all aspects in life. Question 92. The nurse is preparing to admit a patient from the emergency department. The transferring nurse reports that the patient with chronic lung disease has a 30-plus year history of tobacco use. The nurse used or smoked a pack of cigarettes a day at one time and worked very hard to quit smoking. She immediately thinks to herself, I know I tend to feel negatively about people who use tobacco, especially when they have a serious lung condition. I figure if I can stop smoking, they should be able to. I must remember how physically and psychologically difficult that is, and be very careful not to let be judgmental of this patient. This best illustrates A. Theoretical knowledge, B. Self-knowledge, C. Using reliable resources, D. Use of the nursing process. Answers B. Explanation. Personal knowledge is self-understanding awareness of one's beliefs, values, biases, and so on. That best describes the nurse's awareness that a bias can affect her patient care. Theoretical knowledge consists of information, facts, principles, and theories in nursing and related disciplines. It consists of research findings and rationally constructed explanations of phenomena. Using reliable resources is a critical thinking skill. The nursing process is a problem solving process consisting of the steps of assessing, diagnosing, planning outcomes, planning interventions, implementing, and evaluating. The nurse has not yet met this patient, so she could not have begun the nursing process. Question 93. Which organization standards require that all patients be assessed specifically for pain? A. American Nurses Association, ANA. B. State Nurse Practical Acts. C. National Council of State Boards of Nursing. And C. SBN. D. The Joint Commission. Answer D. Explanation. The Joint Commission has developed assessment standards, including that all clients be assessed for pain. The ANA has developed standards for clinical practice, including those for assessment, but not specifically for pain. State Nurse Practice Acts regulate nursing practice in individual states. The NCSBN asserts that the scope of nursing includes a comprehensive assessment, but does not specifically include pain. Question 94. Which of the following is an example of data that should be validated? A. The urinalysis report indicates there are white blood cells in the urine. B. The client states she feels feverish. You measure the oral temperature at 98 degrees F. C. The client has clear breath sounds. You count a respiratory rate of 18. D. The chest X-ray report indicates the client has pneumonia in the right lower lobe. Answer B. Explanation. Validation should be done when subjective and objective data do not make sense. For instance, it is inconsistent data when the patient feels feverish and you obtain a normal temperature. The other distractors do not offer conflicting data. Validation is not usually necessary for laboratory test results. Question 95. Which of the following is an example of appropriate behavior when conducting a client interview? A. Recording all the information on the agency approved from during the interview. B. Asking the client, why did you think it was necessary to seek health care at this time? C. Using precise medical terminology when asking the client questions. D. Sitting facing client in a chair at the client's bedside using active listening. Answer D. Explanation. Active listening should be used during an interview. The nurse should face the patient, have relaxed posture, and keep eye contact. Asking why may make the client defensive. Note taking interferes with eye contact. The client may not understand medical terminology or healthcare jargon. Question 96. The nurse wishes to identify nursing diagnosis for a patient. She can best do this by using a data collection from organized according to select all that apply. A. A body systems model. B. A head-to-toe framework. C. Maslow's hierarchy of needs. D. Gordon's functional health patterns. Answer C and D. Explanation. Nursing models produce a holistic database that is useful in identifying nursing rather than medical diagnosis. Body systems and head to toe are not nursing models, and they are not holistic. They focus on identifying physiological needs or disease. Maslow's hierarchy is not a nursing model, but it is holistic, so it is acceptable for identifying nursing diagnosis. Gordon's functional health patterns are nursing model. Question 97. The nurse is recording assessment data. She writes, the patient seems worried about his surgery. Other than that, he had a good night. Which errors did the nurse make? Select all that apply. A. Used a vague generality. B. Did not use the patient's exact words. C. Used a waffle word, for example, appears. D. Recorded an interference rather than a cue. Answer A, C, and D. Explanation. The nurse recorded a vague generality. He has had a good night. The nurse did not use the patient's exact words, but she did not quote the patient at all, so that is not one of her errors. The nurse used the waffle word, seems worried, instead of documenting what the patient said or did to lead her to that conclusion. The nurse recorded these interference, worried, and had a good night. Question 98. A patient is admitted with shortness of breath, so the nurse immediately listens to his breath sounds. Which type of assessment is the nurse performing? A. Ongoing assessment. B. Comprehensive physical assessment. C. Focused physical assessment. D. Psychosocial assessment. Answer C. Explanation. The nurse is performing a focused physical assessment, which is done to obtain data about an identified problem, in this case, shortness of breath. An ongoing assessment is performed as needed after the initial data are collected, preferably with each patient contact. A comprehensive physical assessment includes an interview and a complete examination of each body system. A psychosocial assessment examines both psychological and social factors affecting the patient. The nurse conducting a psychosocial assessment would rather information about stressors, lifestyle, emotional health, social influences, coping patterns, communication, and personal responses to health and illness, to name a few aspects. Question 99. The nurse is assessing vital signs per patient just admitted to the hospital, ideally in if there are no contraindications. How should the nurse position the patient for this portion of the admission assessment? A. Sitting upright. B. Lying flat on the back with knees flexed. C. Lying flat on the back with arms and legs fully extended. D. Side lying with the knees flexed. Answer A. Explanation. If the patient is able, the nurse should have the patient sit upright to obtain vital signs in order to allow the nurse to easily assess the anterior and posterior chest for auscultation of hold and breathe sounds. It allows for full lung expansion and is the preferred position for measuring blood pressure. Additionally, patients might be more comfortable and feel less vulnerable when sitting upright and can have direct eye contact with the examiner. However, other positions can be suitable when the patient's physical condition restricts the comfort or ability of the patient to sit upright. Question 100. For all body systems except the abdomen, what is the preferred order for the nurse to perform the following examination techniques? A. Palpation. B. Auscultation. C. Inspection. D. Percussion. A. DBAC. B. CADB. C. BCDA. D. ABCD. Answer B. CADB. Explanation. Inspection begins immediately as the nurse meets the patient, as she observes the patient's appearance and behavior. Observational data are not intrusive to the patient. When performing assessment techniques involving physical touch, the behavior, posture, demeanor, and responses might be altered. Palpation, percussion, and auscultation should be performed in that order, except when performing an abdominal assessment. During abdominal assessment, auscultation should be performed with palpation and percussion to prevent altering bowel sounds.
Thank you for watching.